Hi, my name's Linda Bermania, and I am going to tell you about the project that I began and completed, and I have it titled Improved Patient Surveys. The survey was actually completed for a local hospital, physical medicine department, otherwise also known as a rehabilitation department, and they have physical therapy, occupational therapy, and speech therapy within that department. I first want to kind of talk to you about the executive summary and kind of what you will learn from the actual paper project itself. The purpose of doing this was actually to implement a new patient questionnaire regarding the healthcare services that the patients are receiving. By doing the project, we are going to ensure that the patients are answering questions regarding to the physical medicine department and not actually answering questions related to other areas within the hospital. Because the physical medicine department not only sees inpatients, but they also see outpatients. So when a patient receives a survey when they are actually admitted to the hospital, they receive an inpatient survey. The survey that the patients are receiving as an outpatient are discussing things about like nursing care, registration process, things like that don't pertain to the physical medicine department. So through this project, we're actually changing it so that they can actually get better satisfaction scores. Right now, they currently have a 70% patient satisfaction survey. Their organization's goal is to be at 86%. So as a department, they needed to look at what they could do to improve that. The rationale for this project, again, we'll start with that the physical medicine department was concerned about their scores, and again, that the patients weren't having clear enough questions, thus not giving them true data. They, again, were not meeting the organization's goals for patient satisfaction, and the department wants to get rid of the negative responses that they were receiving. They discussed some of their primary goals with me, and those basically were to improve satisfaction scores. They also want to increase patient volumes, and they felt that the best way that they could do that is if their satisfaction scores were better, that people were more likely to, tell one or two people, hey, I had a really good experience at that hospital, I'd recommend going there. Because we do know that patients, when they have a negative experience, are likely to tell 7 to 10 people about that experience. They only tell about 1 to 2 about a positive experience. And lastly, they want to continue to rank in the top 10% of rural hospitals and clinical access hospitals, which they've been doing for the last 2 consecutive years. So before going further into the description of the project, I want to continue to tell you about rationale for this project. The therapy department, again, currently is only ranking at 70% of patient satisfaction scores within actually the Midwest region of the country for critical care hospitals. And the organization's goal is to be at 86%. The supervisor has also told me that the department and the therapists, they are actually trying to set their goal even higher to be around like 89%. So that was actually nice to hear, and that they were really on board about getting the questions changed. The supervisor also is telling me that once the department has met the goal of 86% and maintained it for at least 6 months straight, she then wants to review the data and the questions and make some changes as needed. I'd have to say probably one of the most important reasons for making sure that a patient satisfaction survey comes back positive and that you're meeting that organizational goal is because Medicare and Medicaid, they have their own patient satisfaction surveys that they send out, and we call it HCAHPS, but that stands for Hospital Consumer Assessment of Healthcare Providers and Systems. It's a 27 question survey, and it was created by the Centers for Medicare and Medicaid Services in partnership with the Agency for Healthcare Research and Quality. The reason that these surveys are sent out, and they are actually sent out to approximately 3 million patients throughout the country, because every year approximately 4,000 hospitals conduct the HCAHPS surveys. And every hospital is faced with the challenges of dealing with angry patients and even agitated patients. But it's critical to develop the best practices and follow them. A hospital, the organization wants to have that highest patient satisfaction rating because Medicare and Medicaid want to make sure that the Medicare and Medicaid patients are receiving the same quality of care that patients insured by with Deemed Care, Blue Cross Blue Shield, Network Health, and things like that, that everybody across the board is receiving the same quality of care. Because it has been known also within the medical profession that Medicare patients sometimes were not receiving the same quality of care as what private insurance patients were getting. So Medicare has taken it upon themselves to help bridge that gap. Because if you do not score well enough on the HCAHPS, the amount of Medicare reimbursement for your patients is lessened, and the higher your score on the HCAHPS is, the higher reimbursement you get from Medicare for the services you provide. So again, this was a highly motivating factor for the supervisor of the physical medicine department to improve these scores, as well as the therapists. So a little bit about the project itself. The department got together with the supervisor, and she met with them and asked them kind of what things that they were looking at that they wanted to have be improved. And they talked about new equipment, changing the decor in the department because it was getting old. They talked about making easier to understand patient exercise programs, and then also improving their patient satisfaction scores. So she then reached out to me and asked if I would be willing to work on this project, collect the information, collect the data, come up with some new questions and stuff like that, and possibly about how we could be able to somewhat do this internally by collecting the data, getting the scores, things like that. So I asked her for a copy of the current patient questionnaire questions. She did that. And so I looked at those, and I was quite shocked because there's at least like 3 or 4 of the questions that really did not relate to the physical therapy department. For example, there's a question on there, how prepared did you feel for your appointment? I don't really think that any patient is going to feel real prepared for their appointment. So we changed that question. Then there's another one that says, how would you rate your registration process? Well, the registration process does not take place in the physical medicine department. So that right there is one question that was automatically bringing the physical medicine department's scores down because they were rating a totally different department. There was also one, how well did the staff work together to care for you? When you come for one individual physical therapy or occupational therapy or speech therapy, you're meeting with one therapist per discipline. Now, you might see all 3 of them, but it's each individual person, and that's what we want to have for the response. However, I have built into the project that if somebody has seen all 3 disciplines, we will ask them, do you want one survey and discuss everybody on that one, or do you want one for each therapist, and let them decide. Then there's a question that wasn't very clear, that did you experience any significant delays during your visit? That could have been at registration, it could have been within our department. We just needed to make it a little clearer. And then another question was, did you receive any instructions for follow-up care? We don't necessarily give follow-up care. We will give them a home exercise program. So I needed to change how that was being phrased so the patient had a better understanding. Then the next question that was really throwing them off was, during this visit, were you given any medication that you had not taken before? And then it's actually asking, how would you rate your nurse? We do not have a nurse in the physical medicine department. So I needed to actually change that, because as therapists, we do not prescribe medication or actually administer medication. And then I kind of looked at it, and it was sort of like, how much do you trust the facility to take care of your needs? I really wanted to relate that back to the therapist or the actual department itself. And then it was, how easy or difficult was it to obtain care you needed? Sort of a vague question, so I have changed that to make that a little bit clearer for the patient to understand. So what I did is, I'm going to now tell you the new proposed questions. So what I came up with over the 8-week period that I've been working on this is, I stuck with 13 questions because that's what the original survey had, and I thought, well, okay, for percentage sake and all of that, it's probably the best thing to do is keep with 13. So the first question is, was the physical medicine department reception staff friendly and helpful? And then it's, please rate on a scale of 0 to 10, and then please tell us about your experience, because we want to know negative and positive. Number 2 is, how would you rate your session in therapy today? On a scale of 0 to 10. And then please tell us about your experience. Number 3, was your therapist on time for your appointment? Yes or no? If they were running late, did the reception staff keep you informed as why and how long it would be? 4, did you have a feeling that the reception staff cared about your needs? Yes or no? And then also please explain. 5, how would you rate the staff of the following? A, treating you with courtesy and respect. B, responding to your concerns and complaints. C, concern for your comfort. D, provided care in a safe and secure manner. E, listening carefully to you. F, explaining things in a way you're understood. We want them to actually rate it as very poor, poor, fair, good, or very good. And I've left it on the questionnaire that they can actually place an answer behind each one if they so choose to do that. Question number 6 was, how prepared did you feel the therapist was for your appointment today? Very unprepared, somewhat prepared, neither prepared or unprepared, somewhat prepared, or very prepared. Number 7, did you receive any instructions for exercises to complete at home? Yes or no? And if yes, how clear were the instructions for the exercises? Not at all clear, somewhat clear, moderately clear, very clear, or extremely clear. 8, how much do you trust the physical medicine department to take care of your needs? And then we have not at all, a little, a fair amount, quite a bit, or a great deal. 9, did you have a delay in starting your care from the therapy department? Yes or no? And if it was yes, I wanted them to explain it. Did they need to get insurance coverage? Did they need to wait so many weeks after a surgery? Anything that it might have been. That's probably the one question we're going to look at further on down the line, is like, do we need to completely take that question out of there? Number 10, how would you rate the overall care you received while at the therapy session? Very poor, poor, fair, good, or very good. Number 11, did your therapist appear concerned with your complaints and concerns today? Yes or no? And if no, please explain what could have been done better. We definitely want the patient to make sure that they feel heard, and that we are having concern for what they're feeling and that they just don't feel brushed off by what they tell us. Number 12, did you feel comfortable speaking with your therapist about your concerns and or issues? Yes or no? And then I put in parentheses, relating this to privacy you felt you may have needed. And if no, please explain better. Because we do take patients out into a large gym, and there might be 4 other patients in that gym, and and we're talking with them, and we just want to make sure that they feel like they have access to a private area where they can speak to the therapist. And number 13, how likely are you to recommend the physical medicine department to friends and families? And again, on a 0 to 10 rating, and we want them to explain why. So we are also we've decided to take these surveys off of being online because we have a significant amount of elderly patients that come into our department, and they do not work on computers, they don't have smartphones, so we wanted to go back kind of to the old school paper and pencil. So what we're planning to do is we're going to actually give the patients a survey after each visit with an envelope. They can actually complete the survey right away, put it into the envelope and seal it so it's confidential, so that they know nobody in our staff is going to read it and have any bias or hold anything against them at any reoccurring visits, or even if they need to be seen again, in a year or two. We want them to know that it's confidential and that they can be as honest as they possibly can be with us. And we're letting them know that we are actually trying to make sure that we are providing the best patient care and that their satisfaction means a great deal to us. So to do that, we are actually going to hire a person that will actually review, organize, analyze the data for us so that nobody in our department is actually doing it. That person will be a hospital employee, but they're not going to be any part of the survey except for collecting, analyzing, and giving the data back to us. And we felt that that was the best way possible to do that. We're also looking at a plan B, is that if there's a lack of feedback and a return on the surveys, we may have to look at possibly having it online for some people and having it in paper for others, and we're just going to kind of see how it goes. And again, we're going to try it for 6 months, and then we're going to reassess it. And looking at it again in about 6 months, it's probably going to take us anywhere between maybe 4 to 6 weeks to research the data that we get and see if anything really needs to be changed or not. One quote that I absolutely love is this quote: "A customer is the most important visitor on our premises. He is not dependent on us. We are dependent on him." From Mahatma Gandhi. So next I want to talk to you about the budget for this project. I had originally thought that this really wouldn't take that much actual financial piece of the department's budget. I originally thought it was going to be about $5,000. However, the final budget amount came to $11,846. And how that came down is that there's 80 hours for me at $35 an hour, which was $2,800. Then there's 8 hours for our receptionists, and that's going to be folding and putting the surveys into the envelopes to kind of get us started. And then there's 10 hours at $55 an hour for a physical medicine supervisor, so that comes out to be $550. And then we have 40 hours a month for the occasional status employee that we're going to hire to actually collect and analyze and, put the data into Excel sheets and graphs and everything like that for us. And that's going to be, so it's going to be 40 hours per month for 12 months at $17 an hour, comes out to be $8,160. And then we're actually going to start out with 20,000 surveys. So that'll be $200. And that's how I come up with the $11,846. Did not think it was going to be that much, but when you think about it, everybody thinks about budget and, you know, like buying things and stuff like that. And we always have to remember that people's time is actually money. And when you look at that and break that down about like the number of hours during a workday that somebody's working to complete something, this actually shows me, as well as the supervisor of the physical medicine department, that making sure that the scores do improve and continue to be at that 86%, if not higher, you do have to spend the money to reach that goal. The plan for the survey launch was, you know, I had to do the planning, and I developed the questions that were going to be done. I then presented it to the therapists and the supervisor and the director to kind of let them know. I let them look over the questions. They thought the questions were great. And then I did the education with them. That I educated the receptionists on what was going to be expected of them, that they'd fold the surveys, put them into the envelopes. They could either give the survey to the patient when they showed up for their appointment or when they leave. But between the therapist and the receptionist, we needed to make sure that that patient left with a survey. And then fifth is that we launched the project. So we are in the 6-month period here where we're going to collect the data and then look at it at the end and see how good we did. The timeline that I had for this project here, and I've got a few dates listed here on the screen for you, but I'll kind of give you an idea. On September 2nd, I started thinking about the project ideas and what I wanted to do, figured out what I wanted to do, and actually decided on the patient survey. On September 4th, I met with the physical medicine supervisor, got her thoughts on it, and she was actually in agreement and thought it was a great idea and that things needed to be changed. So then around September 7th and the 14th, I spoke with a dear friend of mine, Candace Hurley, and asked her to mentor me and told her about the project, and she agreed to do that. And we had various phone conversations throughout the month of September. However, on September 28th, you can see there that I had some struggles with the project, but I was able to develop new patient questions, because that was really what I was struggling on, is that were these questions clear enough and stuff like that. And then on October 20th, we finalized the project. So next, this is Candace, and she was a great help in helping me make it through this project. The 5 courses that I learned the most lessons from during this project would be effective business communication, the principles of management, intercultural communication, servant leadership, and business law. The 2 that stand out to me the most are servant leadership and business law. Help me learn what things you can and can't do within the business setting, and then servant leadership, making sure that I continue with what I'm passionate about, is making sure that I'm a leader that also serves. Looking at the 4 R's of reflective writing, I would have to say the one that I really want to touch base on is the responsibility. Because I cherish being a servant leader, I feel that my main responsibility is to serve others. I like to help them, teach them, and I also learn from them so that everyone can succeed. It's also my responsibility to continue to grow and learn as a leader, coworker, wife, mother, to make sure everyone is successful and happy. And in conclusion, I'd just like to say that at the end of this course and completion of the project, it has taught me more about myself than I ever thought it would. This has been an ongoing project. Changes will be inevitable for continued success. Thank you.